It's 10 o'clock and we are ready to start our virtual information session on COVID-19. My name is Anna Fall. I'm the Executive Director of the Trager Institute, and I want to welcome you all to this session. First of all, I would ask you that you keep your microphones on mute and just take it off mute when you want to ask a question. Next slide, please, Justin. So as I said, please mute your mics, keep your video off if you don't want to be taped. We are taping this session because we want to make sure we can spread information to more people. So if you feel uncomfortable being taped, just put that off. If you want to ask a question, you can type in the chat or you can raise your hand. If you go to the chat at the bottom of your screen, you'll see there's a little button that you can click that takes you to the chat where you can ask any question that you want and we will handle that. We will alternate between questions asked and raising your hand. Please use respectful language, and if you are concerned about your health, there's our number to call, 588-4340, or you can call the hotline at 800-722-5725. Next slide, Justin. If you have difficulty with your sound, you can click on the arrow next to the microphone to the test system. You can look here on the picture here if you have any trouble there. Right now we have you all muted, but if you want to talk, you just need to unmute yourself. Next slide. Now we would like to just very quickly, if you can, just type us from what county are you from. We just want to make sure that when we're going to talk today a little bit about resources, that we address your county as well. We don't want to just focus and assume that it's only from Jefferson County. So thank you for that. That will give Barbara, who's going to talk a little bit about resources for older adults, a better picture of where everyone is coming from. So thanks, everyone. We really appreciate you being on this call. Within 1 week since we last met, much has changed in our world and in our community. We have made plans to implement physical distancing methods by working from home and even visit with our family and friends remotely using the technology we have available to us. And we are really fortunate as a country to have all of these resources. So sometimes, you know, we need to maybe pause a minute and just be thankful for what we have here. This morning, we have the honor of having Dr. Ruth Carrico with us. I hope I say her name right. She is an infectious disease specialist, and she's going to share some up-to-date information with us about the coronavirus and where she sees this pandemic is taking us. Also, we have Dr. Christian Furman, the medical director of the Republic Bank Optimal Aging Clinic, who will give us an update on how we will keep seeing patients in a way where all of us can be safe. Then I'm asking two of my colleagues at the Institute, Barbara Gordon and Erica Osborne, to share some of the resources available in our community as well as lonely and isolated older adults. Due to Dr. Carrico's limited time, we are going to start with her, and then after her update, we will allow for questions directed to her first before we'll continue with our other guests. Dr. Ruth, are you on? She is so busy, we had to call her to remind her again. I just want to make sure she is on. I'm not hearing from her. She did say that may happen. So if she's not on yet, then maybe I am going to ask Dr. Furman to start and give us an update as to how we are going to still seeing patients. Dr. Furman, you're on mute.
There we go. Sorry. So I'm Dr. Christian Furman. I'm the medical director here at our Trager Institute, Republic Bank Foundation, Optimal Aging Clinic. And so, yes, thank you everybody for doing your part. Everybody's practicing social distancing and washing their hands. And because of all the changes and people are having to work from home, we're changing our clinic schedule here in the office, where we're going to be open from the actual office will be open from 8 a.m. to 12:30 p.m. And we'll see patients during those times that need to be seen face to face. In the afternoon, we'll be closed and patients can telehealth. So we've called all of our patients and given them 3 options. One is to move the appointment 2 months out. We're thinking in 2 months, things will settle down. It might not settle down in 2 months and we have to readdress it. But for now, we're giving people the option to move it 2 months out. or we're giving people an option to change whatever appointment they have currently to a telehealth appointment. So just keep the same time and we'll do telehealth. And the third option is to come in and be seen if they don't have telehealth. And in the mornings, when we're seeing patients, we've kind of gone to a skeleton crew. And so we have Elizabeth Bolpert, our nurse practitioner, here on Monday mornings. We have Dr. Josephine Gomes, our geriatrician, on Tuesday mornings. Dr. Jessica Dow, our family medicine physician, on Wednesday mornings. Angela Leinenbach, our nurse practitioner, on Thursday mornings, and Dr. Peter Esch, our geriatrician, on Friday mornings. And so we'll be able to meet everybody's needs and refill medicines. And we just started this. We did the first telehealth on Friday. I did some yesterday. It's really going well. Older adults can do telehealth. Some people have family with them to help them with the technology, but the technology is very simple. We're using Doxy, doxy.me. And so we just need your email, and we send you an email. And then in that email is a site that you just click on that site, and it pops up and it puts you in our waiting room, our virtual waiting room. And then when we get on, we'll have a two-way conversation, and we'll be able to, watch you walk, ask memory questions. We cannot listen to the heart and lungs. We cannot take vital signs. So some patients are doing their own vital signs. They're taking their own blood pressures. They're taking their own temperatures and letting us know. They're weighing themselves and letting us know what they find. The big issue, I want to tell people that if you do, we have people on controlled substances, pain medicines or other controlled substances, where there has to be a face-to-face visit by Kentucky law every 2 months. And we're going to keep doing that, but they're going to be telehealth visits. So everybody that has on controlled substances, we do need you to keep your appointments every 2 months, and we'll just convert those to telehealth appointments. The other thing is new patients. All the new patient appointments are being moved to the morning, and patients are either seeing Dr. Jessica Dow or Angela Leinenbach, our nurse practitioner. So Wednesday mornings is Jessica Dow, and Thursday mornings is Angela Leinenbach. So we can get you back to seeing whatever doctor you wanted to see originally when the pandemic settles down. But for right now, we're moving all the new patients' appointments in, or we're scheduling them 2 months out, whatever the patient wants to do. And then to do these telehealth appointments, we need an email address, and the computer needs to have a video, camera in the computer, so we can do it that way. But if people don't have that, we can FaceTime people if they have a phone. We can FaceTime on the phone. So we need to have your cell phone number, and we need to know if it's either. Maybe I'm just hearing some background. Maybe if people could just mute it. I think where everybody's muted. But
hey, Christian, it's Ruth Carrico. I think I just got unmuted. So hopefully it's. I'll go ahead and mute myself until you're ready, and maybe it's my noise from the car.
Yeah,
so,
no problem.
But,
I'm almost finished, and then we'll have you go, Ruth.
Okay.
That's great.
All right.
So one thing with the telehealth, that's perfect, is we need the email address, and we need to know your phone number. We need to know if it's an iPhone or an Android phone. And then we also need all of our patients to get on the patient portal and sign up for the patient portal if you haven't already done that. But if for some reason we can't get the computer to work, we can't get FaceTime to work, we can just old-fashioned call people on the phone, and we've been doing that too. So we'll make it work, whatever, we're flexible. But now maybe, yeah, Dr. Fall, do you think it's good for Dr. Carrico to go now?
Thank you, Christian. Yes, Dr. Ruth, welcome, and thank you so much for spending time with us this morning. I know you are extremely busy. I want to ask you if you can provide us some updates related to COVID-19, and do you have any prediction about when this isolation may end?
Okay, thanks, and I appreciate it. I know we're all busy, so each one of us are in a completely different place in our lives and career and our work. So a couple of things, and let me kind of start off with what we are doing and how we came to know what we know. So at present, we are monitoring patients. We have an active surveillance program that we are monitoring all of the 10 area Louisville hospitals and the 2 in southern Indiana. They are free to send us surveillance cultures of patients that they are identifying with symptoms that are suspicious for COVID-19. So at present, we have, I think we have completed over 1,000, about 1,100 cultures. So we can look and see where the cases are, try to gain information about them, and we're learning about best practices. So for example, one of the things that we have learned is that when we do a specimen collection, and we're doing this either by nasal pharyngeal swab or oral swab, if we can swab the individual within the first 5 days of their symptoms, we are likely to get good results. After day 5, the virus leaves your upper respiratory tract, and we are then more likely to find it only in sputum or lung specimens. So the key is early identification if we're going to try to find the patients. We are doing this for two purposes. The purposes of this surveillance are, number one, to identify patients so we can use our resources appropriately, personal protective equipment and environments such as private rooms and negative pressure rooms. The second is we want to protect the workforce. So we want to identify patients who are positive and isolate them effectively and make sure that that information is available so we can have practices within the healthcare facility that will minimize transmission opportunities. We know that we are seeing increased cases throughout the community. We expect that to occur. We know that this is the nature of a viral illness for which we have no immunity, that we will see illness throughout our community. It's important then to identify these early so we can stop transmission and we can do what everybody is talking about with respect to flattening the curve. We want to flatten the curve so that as this moves through our community, just like flu does, during flu season, that we do not have individuals who become sick all at the same time and then are able to transmit to others and then impact our emergency operations such as healthcare. Remember, all aspects of healthcare, whether it's acute care, long-term care, we are all a critical infrastructure for the community. So it's important that we have a strategy for how to best deal with this. Now, some of you may be saying, well, we have some of our long-term care residents who have moved back and forth in and out of hospitals, and you have questions. If they were tested in the hospital, our process is every day we are testing anywhere. We began testing an initial 25, and now we are up to testing about 200, between 200 and 300 a day. Those results go back to the chief medical officer at the hospital, and then the information is shared with the whoever the attending physicians are and the infection preventionists and so forth at those facilities. If you are in a facility and you say, gosh, I need some information, I would ask that you work with your infection preventionist. And if they have a question about a patient, I'm going to go out on a limb and I'm going to say they can email me and I can find out if the person has been tested. If they haven't been tested, I won't have any information to share, but at least I could share what I know. That would enable you in long-term care to, if you have someone in isolation, you can get them out. We are also learning a best practice on how we provide results, because we were initially providing results according to what the testing methods are for the places where we get the tests and the reagents. And they were telling us to report as presumptive positive unless the person was negative. Well, we learned that was the very wrong thing to do, because we would have someone that would be discharged when they had a presumptive positive test, when in actuality, as we confirmed that test, it was negative. So we are changing our communication approach and using the language that is going to reflect more adequately and accurately the status of any individual patient. So we will not create any concerns, or we won't have to worry about maybe somebody didn't communicate when that status was known, or so forth. So what I'm asking, I guess my big ask from this group today is, number one, tell me what your ideas are with respect to sharing test results, if you have questions about that. And number two, as we begin to look at expanding surveillance, what kind of strategies, and this is kind of a some high level consideration, what types of strategies do we need to have in place for long-term care? I would tell you that if you have an occasional patient that you are unsure of, or there is some question, that I feel confident that we could fold these individual tests into the testing process. Now, I don't know how to do that, and I just said this without my boss telling me that was okay, so he may end up, conking me on the head and saying, what were you thinking? But, the idea is, how do we understand healthcare as a community process, and that the barriers between acute care and long-term care are completely blurred, and we need to operate in that present reality. So, having said all this, let me stop and take some questions from you guys.
Justin, are you going to read the questions, or can I read it?
I can do it. It took me a while to scroll back all the way up to all the people that are participating. So Dr. Ruth, there are some questions in the chat. Is Kentucky having an easier time obtaining COVID-19 tests? Is there still a significant shortage? And what is the capacity?
There's still a significant shortage that, a number of the national labs are coming up with their tests. The issues are their capacity. Nobody has much capacity. Now in Kentucky, we have a little bit more capacity, primarily because in Louisville, we have this surveillance method. So we are using high capacity testing methods so that we have the ability to quickly test and quickly provide results. So this is part of this surveillance process that we have implemented. This has really been enabled by the fact that at the University of Louisville, we are linked with the network of 13 national biosafety BSL3, biosafety level 3 labs that are around the country. So we have different types of equipment that we're able to put into play, and frankly, some really expert people dealing with viruses and the testing for viruses. So this has enabled us to bring this surveillance program up. Obviously there's not a lot of publicity about this because we do not have the capacity to randomly test the community, including those that, the worried well, that right now our single focus is on protecting healthcare. And that means protecting the healthcare worker. And in doing so, we can then, we need to rapidly identify patients so we can get the negative patients out of isolation and make sure the positive patients are in isolation. And then, of course, we report to public health, so they then are involved in contact investigation and tracing and so forth. So the answer is, nationally, the capacity is growing. In Louisville, we've just been able to grow it more quickly, but everybody still doesn't have what they need. Remember, we started testing 2 weeks ago. It seems like 2 years ago to me. And we started performing a test that nobody had the ability to do. And 3.2 million people in the U.S. were all going to want it. So just to kind of put things in context.
Another question in the chat. People are volunteering to sew fabric masks for local providers. Are these masks appropriate, or is this effort futile?
Well, I think, when we look at how this organism is transmitted, it's transmitted primarily by the respiratory route. So that means if somebody coughs in your face, they contaminate with those respiratory particles, they will contaminate that mask. So if it's a traditional mask that we use, one that, has some fluid resistance, then the wetness of those particles don't wick back into your mouth. And that's what can cause transmission to you. So my concern in having something that is cloth is that it's going to get wet when a patient coughs on it. It's going to then wick right into my mouth that may make me ill. But also, I'm going to be touching that mask repeatedly throughout the day. My hands are going to be contaminated. And then just routinely, even without thinking about it, we put our hands to our eyes throughout the day. We rub our eyes, we rub our nose, we put our finger up our nose, whatever. But that is involved in transmission. So I really am not sure whether this is a help or whether it's actually more of a hurt. Although I think it's great that the nation wants to help us, I'm just not sure that is a help at this point in time. Now, I could be wrong, and I could be saying if we completely run out of masks that, you know, I'd give anything for one of my friends to sew me one. I may be at that point at some point, but I'm still kind of on the fence about that. I'm trying to understand it kind of from a science and transmission perspective, whether that'll help or not. So I don't know.
And so what can families do with the new mandate that private duty caregivers cannot go into facilities to provide supportive care?
Yeah, that's awful, because here we are at end of life, and we've had a number of situations where people have said, can't you give me a note? Can't you do anything to help me? And I think, at this point, we're making decisions about the health of the public. And I know that there is great suffering by the needs of the few when we're trying to look at how we manage this in a larger context. But I think, unfortunately, we've got to look at how we prevent transmission, and visitors and so forth may inadvertently become ill themselves, and then they don't realize it, and then they can be involved in transmission. So I have to support the public health notion of that restriction, although it breaks my heart to do so.
So what is the expectation of COVID-19's impact on Kentucky, and is there a projection for how long we will need to practice social distancing to the extent that we are now?
Well, I mean, we don't know. I mean, we're expecting that we're going to see a big impact in the community, and I think that's why our mayor and our governor are beginning to shut down businesses to prevent transmission opportunities. I think that everybody will expect that we will do the same thing in Kentucky that has been done in other states, and we will reach a point where, we're on shutdown, and that, only that, that the streets will be empty and you will see the healthcare workers going to work. Those are the ones that you want to be at work to help take care of this and then be able to work with containment. I would, this is my opinion only, but I don't think we're very far away from that at all. So I think, this is a time personally that you kind of prepare, and I guess that's why there's no toilet paper in the world, that everybody's preparing for that. But I think, think about, what if all of a sudden I'm at home and the only thing I'm doing is coming and going to work? Think about the times in the past when we've had big weather, and we have stayed at work, and we have lived at work, and we're working shifts because either others are ill or we have problems, but other problems. So I think it's kind of coming to grips with the fact that this is not life as usual. We are in a very different time. We haven't seen this for 100 years. The benefit that we have right now is that we've got rapid communication, and we are performing active surveillance. And through this, that, we will be in much better shape. But this is a time where, we're in it together because we're in it together. And we'll take it as it comes.
Thank you. And then when reporting number of tests administered, is that at UofL Hospital, all hospitals in Jefferson County, or hospitals in Kentucky?
No, these are hospitals in the Louisville area.
Okay. And Dr.
And
Nash,
so,
go ahead, sorry.
No, go ahead. Excuse me.
Dr. Whitney Nash just echoed your concerns about the false sense of security for nurses wearing cloth masks. And she asked, do we need a statement?
So, well, I think, you know, we're seeing so much of this come nationally that I don't know that I want to make a Ruth Carrico statement that I think probably will have something, you know, more broadly. But yeah, I think, you know, we're recognizing that everybody wants to help. And there may be some innovation that comes out of this. You know, for example, there's, now I don't want everybody to run out and like buy up all the vacuum cleaner bags, but, you know, we know vacuum cleaner bags provide, you know, a high level of filtration. So we've all seen people that are making masks and putting, you know, embedding in them some of this, you know, vacuum cleaner bag, this filtration. So I say this because there's going to be some incredible innovation that is going to come out of this. So we don't want to quell innovation, but we're going to have to make sure that people understand the basics of how this infection is transmitted and that they are able to use that information and think critically about what does that mean then. If I understand that if somebody coughs in my face, then those particles may go in my face that will go to things on my face, and those that don't hit my face will hit the environment. Therefore, what does that mean to me for my practice? Well, it means I need to keep my environment clean. It means that I need to have some sort of barrier. So, you know, my thought, if people were going to make things, my thought would be that you have a whole boatload of face shields, because I am much more likely to have those particles hit my face regularly than to inhale those particles. So I would rather at that point, if somebody wants to make me a face mask, a cloth face mask that I wear underneath my face shield, that I can begin to see then that there may be some value. But I think that your point is very well taken, that we probably need to get, and what we're finding with our surveillance, we're actually beginning to develop policy on how to approach this. So this may be a discussion that we say, all right, you know, we've got a lot of people that want to sew, that they're at home and they're making face masks. How can we best use them, and what are going to be the triggers to enable us or to tell us that, hey, this is what we've got for a while. Now, I know manufacturing, the industry is looking at all aspects of where they have protective equipment that could be used all throughout, non-healthcare industry that uses some type of respiratory protection. So part of what is being done now nationally, I know, is try to mobilize where those resources are and how to best distribute them, and make sure that we don't have like the guy that was on Facebook selling the stuff for, $100 or whatever. So yes. So I'm sorry, I'm gonna have to drop off. I apologize, I can't stay on any longer, but if there are questions that are urgent, then I think Dr. Furman, I know, has my email address, and I'll be glad to answer. Just realize that I may be a little bit slow, but I'll do my best. So thanks very much, and sorry I can't stay on anymore. All right.
Thank you, Dr. Ruth. We really appreciate this, all these statements you've made. I am going to ask that we continue a little bit by asking some of these questions to Dr. Furman, and if she can provide us some insight on some of these questions, starting with Dr. Joe's question about the governor. Justin, do you want to read that, please?
So, Doctor, a couple comments in the what is the capacity of UofL to serve the needs of COVID-19 patients? And what are your thoughts about Governor Cuomo's comment about restarting the economy by sending younger people or people who have had the virus back to work?
Yeah, so UofL's capacity, they've been sending out, so this is Christian Furman, I'm medical director here at the Optimal Aging Clinic. And UofL has been sending out daily, UofL Health has been sending out daily emails, and they have, UofL Hospital has activated its incident command, which means it's kind of emergency command infrastructure. So UofL, the latest that came out said that, we have 28 days worth of personal protective equipment. So that'll get us through another month. But then we did get a supply from the national stock. So there's another supply expected. So far we're able to keep up. We have enough ventilators, we have enough equipment. It's just a matter of, do we flatten the curve, or is it going to spike? And I don't think we know yet. But right now, UofL has the capacity. Now that we have UofL Health, we have a lot of other hospitals in that health system. So even if UofL gets full, people can go to Jewish, people can go to Shelby County, you know, we can distribute patients where they need to go. So they've looked at all that bed capacity. The last I heard, you know, we have a lot of bed capacity. So we're doing okay, but you know, we're kind of weeks behind New York and California. And New York and California are you know, renting hotels and renting buildings to kind of have these makeshift hospitals. So we're not there yet. So far, so good. And then the Governor Cuomo about restarting the economy, investing in younger people to work, that kind of defeats the purpose. We have to really make sure everybody acts like you have the virus and you don't want to spread it to anybody else. So that's why we're saying, I think our governor is saying healthy at home. We want to say healthy at home instead of shelter in place. Everybody should stay at home. Even younger people should not go to work to help the economy. People that have the virus should not go back to work because you can get reinfected. We don't understand this virus. It's a brand new virus. No one's been exposed to it before. So even if you had the virus, potentially you could get it again. Like, we don't exactly know. I mean, is it the same as every other virus? We don't know enough about it. So we recommend everybody stay at home unless you absolutely have to go out for an essential need. What other question was there?
Dr. Nash, I think she wanted to have a conversation as well. Dr. Nash, do you want to say something?
Yes, just two things. And one, Dr. Furman, just to kind of dovetail on what you just said, I think one of the concerns about that is that, you know, again, we don't know how the virus acts and we don't know what immunity is going to look like. And I think it's a false sense of security by sending young people who maybe even had the virus out, not only because they maybe can't get it again. We would, I guess, make that assumption because they've had it. The issue is that they would still need to be just very, very intentional about the spread of, they could come into contact with someone and then they are a vector to spread to other people. It may not be harmful to them, but they're going to still have the opportunity if they're not just, you know, very diligent about hand washing and whatnot. So I think that's a bad idea. But the other piece I wanted to share is I had talked to Dr. Fall a few days ago. I have two nurse practitioners who have been working over the weekend to develop a sort of best practices, helpful hint video on telehealth. Both of these individuals have extensive experience working in telehealth at another institution. And so that I spoke with them today, and that's going to be available, which I will send to Dr. Fall to send out to anyone who is interested. I asked them to keep it short and just, you know, just kind of highlight some of the key things, particularly as it relates to documentation.
Thank you, Dr. Nash. We will be sure to send this out to everyone after this call. Thank you for that.
Yep.
I am now going to ask Barbara Gordon. She's our Director of on the services that's available to help older adults who are isolated in the community.
Good morning, everyone. Thank you for this opportunity to talk a little bit about older adults and their needs. I first want to say that I did notice that several area agencies on aging across the state are on this call. So as I go through some of the basic and general resources that are available, they'll focus primarily on the KIPTA area, but I do know that there may be phone numbers and contacts for your areas as well. Please put that information in the chat. Put the phone numbers, the resources that are available, or just a phone number where a senior, an older adult, or a professional working with seniors can contact you and you can let them know what you have available. You can also send information to me, and we might be able to even get it in our resource guide that we're putting up on the Trager Institute's website. And the things that I'm going to share with you today, most of those are on the Trager Institute website, and we're developing and building that resource information on a daily basis. So first, the first thing I want to state is that I've literally stayed up at night thinking about older adults who are severely isolated and don't have a good support system around them, and they're having to shelter in place. And believe me when I say we have many older adults in that particular situation who live in the community. That's separate from the older adults who are in the nursing home, who are having to experience this COVID-19 crises alone. I know they have the healthcare professionals there with them, but that's not like having family and friends who can come in. So there are some services and programs that are continuing. Their Medicaid waiver for in-home services is continuing. So if any of your clients, patients were receiving Medicaid waiver before the crises, they should still be continuing that service today. If you keep up with the governor's press conferences, you probably heard that on all of the assistance programs, and that would include Medicaid waiver, they have given a 3-month extension for certification. You know, for all of those programs, you have to be recertified. We have many older adults who get food stamps. That's the SNAP program. They're able to, they don't need to go into the office or call into the office to get recertified during this period of time. And he extended it out 3 months. So that's a significant help. They don't have to worry about re-upping their food stamps or their Medicaid waiver, et cetera, during this time. You can contact the Department for Aging and Independent Living. Their number is 502-564-6930. Many of these information pieces are also on the governor's COVID-19 website, and that is kycovid19.ky.gov. For the KIPTA region, obviously, please contact KIPTA. All of their call center staff are still working. Most of them are working from home, and some are working in the office. And that number is 502-266-5571. KIPTA is an area agency on aging, and there are 14 other area agencies across the state. All of them are frontline professionals who are making sure that the older adults in their communities are continuing to receive services as best possible. One of those services, obviously, is meals. One of the things I want to say about the meal program is that all of you have probably heard about home delivered meals. Please know that many seniors go to the senior center to receive their meals. Those are called congregate meals. What the Department for Aging and Independent Living in the governor's office has been able to do, as well as the Administration for Community Living, is to support an effort to try to make sure older adults have a way to continue to get meals throughout this situation, including those who are going to the senior center to receive meals. And as you know, senior centers are closed. So first, home delivered meals are continuing. And in most areas, probably all areas, and my colleagues across the state and other area agencies on aging, you can let us know in the chat, are setting up the drive-through method for older adults getting meals who were not a home delivered meal client. They went to the congregate meal site. Home delivered meals are continuing as they have been in most areas. And for the Louisville area, there is a daily setup of locations where a person can go and get that meal. That listing is linked to our website. And there is also a phone number that you can call, 502-574-5223. That's 502-574-5223 to learn about those particular locations. Then we also have rural counties in the KIPTA region that are served by our community action agencies. You can call their numbers to get information about how they're providing meals to their seniors during this time. And one of the community action agencies that serve Oldham, Henry, and Trimble County is Tri-County Community Action Agency, and the number is 502-222-1349. The other is multi-purpose community action agency that serves Shelby, Spencer, and Bullock counties. And that number is 502-633-7162. I do want you to know that there are some transportation services that are continuing, particularly for those individuals who need assisted transportation to and from their doctor, who might have home care. They may go to dialysis. These are essential transportation needs, not your regular outpatient clinic appointment, et cetera, but these are essential needs. So that transportation service is continuing. And Jessica, my colleague from HIPTA Area Agency on Aging, can please note in the chat if the Louisville Wheels transportation is continuing. I believe it is as well. I want to also note that if there, some of you may have loved ones in other states across the country that you're concerned about, there is a national website where you can go in and find the Area Agency on Aging who is working in those communities. If you go to this website, you can plug in the zip code for that area, and there's also a 1-800 number. I'll provide that information now. eldercare.acl.gov is the website. The phone number is 1-800-677-1116. So those are some things that I think would be really, really helpful for us to know as we continue to move forward, is that there are essential services that are continuing for older adults who live in the community, including in-home care like personal care, homemaking, etc. There is also some transportation services continuing, as well as the meal program continuing for older adults during this time. Thank you.
Thank you, Barbara. While I'm now going to ask Erica Osborne to share with us some information about our Caregiver and Pills program, these services, to put it in the chat. Erica, just unmute yourself.
Okay, I'm unmuted. Hi, everyone. So we have a couple of different programs I'm going to talk about today. The first is the Caregiver program. And sometimes when we use the term caregiver, that can be a little bit confusing for people because sometimes you think of a caregiver as someone who's being a doctor or a nurse or someone who's in the healthcare community. But a caregiver is anyone who's providing care for someone that's 60 or older. So if you're a daughter or a son and you're caring for an older parent, or if you're caring for a spouse, that makes you a caregiver. What we do at the Trager Institute is we provide a program, and it is absolutely and totally free of charge, where we provide different types of support services for anyone who is caring for a loved one who is the age of 60 or older. We specifically are targeting the rural counties, just because we know that out in the rural counties, sometimes you don't have access to all the different things that you might have in a big city. And the ways that we can work with you, if you are a caregiver, is we can provide some problem solving. If you have different situations that you're encountering and you're not exactly sure what to do, we can help you work through those. We can provide various types of support services, such as support group, and that's a way to get you connected with other people who also are providing care for their loved ones. We also can work on connecting you to resources. We know that you're busy and that providing care for a loved one is a very difficult job. And so you don't have time necessarily to research all the different resources that are available to you, and we can help you do that. The great thing about this program, especially during right now in this time of social distancing, is that we can continue to provide these services to you. We can do so either online over the computer, or we can also call you. It's very easy to get signed up for the program. All you need to do is give us a call. Our telephone number for the Caregiver program is 502-588-3322. We'll make sure to put that in the chat box so that everybody can see it. Or you can email us at tragerinstitute@louisville.edu, and we'll work on getting you signed up for the program. We are actually getting started with a virtual caregiving support group that takes place today at noon. If you're interested in that, feel free to call the line that I've just mentioned, or if you look online at the Trager website or the Trager Facebook page, you'll see a link to that virtual support group that we're going to be offering. The other program that I wanted to talk about today is called PEARLS. And PEARLS stands for a program to encourage active, rewarding lives. And this is also a free program. It is available to anyone who is over the age of 60 or older. And the target of this program is to help you alleviate depressive symptoms. So maybe, especially during this anxious time that we're all experiencing right now, you're not just feeling what you would consider to be a normal level of anxiousness, but maybe also, being depressed. And maybe you're depressed and feeling kind of sad about the situation that's going on, or maybe it's just about, any kind of various change that you may be experiencing in your life. What we want to do is help you tackle overwhelming life issues and also to help you improve your quality of life. If you sign up for this free program, we're going to connect you with one of our Flourish Care specialists. And this is an expert who specifically has training and specializes in the mental health care of older adults. To get signed up for this program, again, it's just a simple phone call. You can call us at 502-588-4340 and then hit number 2. And we can work on getting you connected to one of those people today. You can also reach out directly to one of our Flourish Care specialists, and her name is Allison Handline, and it's just Allison, ALLISON .handline, HANLEIN, and that's at louisville.edu. And there's also more information available at this program at our website, which is tragerinstitute.org. So again, 2 really great programs, free programs that we can continue to offer to you if you're caring for a loved one who is the age of 60 or older, or if you currently are expressing, some issues with depression, we can help you tackle that through our PEARLS program. Thank you so much.
Thank you, Sis. And I want to make sure people know that even though we focus on the Kita region, if you're from a different county, we can connect you with another AAA in your area that can provide you these services. We provide most of these services currently in a virtual format because we cannot go out on home visits and we cannot connect with people physically, but we can do it remotely. So please connect with us, reach out to us. The PEARLS program, as Erica said, is specifically for people who feel lonely and isolated and who just want to have that support. Okay, so any other questions that anyone has for any of us? We still have, yes, Barbara?
I do want to make one statement. With all the phone numbers that are going up, especially for the area agencies on aging, please know that they do have significant call volume, but they all have protocols where if you don't get through the first time, that call will go to a voicemail and they will call you back within 24 to 48 hours, I believe.
Thank you. Thank you. Any other questions that anyone may have for Dr. Furman, for Barbara, for Erica, for any of us that we can help answer for you? You can either unmute yourself and ask the question, or you can type it in the chat.
And this is Dr. Furman. I just want to say, I noticed one of the questions that we didn't get answered by Dr. Carrico was, when is this going to end? And when can we go back to normal? And I don't think we know the answer to that. And so we should, every day at 5, the governor has a press conference. The governor is, Indiana just kind of issued the stay-at-home order. Indiana's right across the river, this stuff spreads. So we should be implementing and we should be abiding by the stay-at-home order. Only essential employees go out, only go out for essential things like gas or food or medicines. So, you know, and just prepare for the long haul. It really might be a while. Classes, you know, most universities have canceled their classes, all of it's online, you know, through May 1st. So, you know, Derby has been rescheduled and things. So, you know, we're planning on the long haul. So just please keep practicing social distancing, 6 feet away. Please wash your hands. Please keep doing what the governor says.
Thank you. I just want to say that there's been a lot of resources put into the chat room. There's a very easy way that you can save the chat. If you look at the area where you type a message, you see these little dots. If you hit on that little dot, it says save the chat, and you can save this chat to your desktop, and you will have all these resources available. Also, we will be putting this in addition to that, we will make sure we put it on our blog and on our website. You can have all of these resources that we mentioned. So don't worry if you feel you've missed a number. We will make sure you have them shortly available on our website and on the blog that we started since last week when we started the session. The other piece that I think Mona indicated here that I think is important for us to stress is that check up on your neighbors. Call people around you, let them know that they will be okay. It's our duty to be out there and supportive of people. So please do that. Remember self-care as well. It's important that we take care of ourselves. I've learned that it's been very draining on me, actually physically, to be on Zoom calls the whole day. I find it very interesting. So I had to figure out a way to distance myself sometimes from the computer. And I think all of us need to do that. We need to figure out a way in which we can distance ourselves sometimes from all this that's happening. And as Joe says, this too shall pass. Some positivity will be good. So let's be positive and realize that, you know, just be aware of our neighbors in itself is such a positive move. Sometimes our lives are so busy that we forget about our neighbors. This is our time to reach out. We are almost at the end of our hour. If there's anything that anyone else, yes.
Can I say one thing? And also, you know, we're learning all kinds of new things. We're learning about how to do telehealth, and we're learning how to put these cool backgrounds. So Dr. Fall, Dr. Yankee Love, and Dr. Joe have, it's really, you can change all your backgrounds. So just let us know if you need information on that, but it's great. It's great technology.
Yeah. Anything else that anyone wants to know or still has a question that you want to get answered? We have like about 5 more minutes. We are here for you and ready to answer anything you have. No? Okay, it seems we can end our session today. Thank you, everyone. If there's any specific thing that you want us to address next week, we will be back next week, Tuesday at 10 o'clock. Please let us know. You can email me at anna.fall@louisville.edu, or you can just send an email to our UofL Trager Institute email address, or you can call us. Anything that you want us to discuss, we will do that next week, and all this information will go on our website shortly. Thank you so much for calling in. We appreciate the time to be with you all. Thank you.
Thank you.